Good morning. My name is Angela Builes. Here I'm going to talk about cognitive aids in emergency neurocritical care setting. I have 10 minutes to talk about this, so thank you so much for inviting me to talk about this. I have to declare the conflict of interest. I created and wrote the Neuroanesthesia Crisis Manual, and from there, the Neuroemergency app. So our objectives today are to define what cognitive aids are, how and they work, review a little bit the cognitive aids literature, and show some resources available for neuroemergency and neurocritical care settings. So the definition, these are tools to guide and to help users to perform a task or a group of tasks, and the goal is to reduce errors so you can do things better, faster, and to not forget steps. So the idea for cognitive aids is to be designed in a way that they are structured and they help you and they guide you. So as you can see, some cognitive aids can be posters, mnemonic devices, signs, warnings, alarms, checklists. Today I'm going to talk specifically about checklists, but there are a lot of cognitive aids out there, and this is like just to talk about creating a cognitive aid. Has it has a science around it. So there's some literature showing how to better write them, how to better display them, the way the things have to be listed so they get prioritized. So you have to make sure the abbreviations are uh, as just as needed. And so please, if you are going to create cognitive aids, go read about it because there's a lot of things that you have to think of. We can talk about cognitive aids, but the first thing you need to think about is when you want cognitive aids, what you're looking for is to communicate better. Like all the literature is showing that what it does is that it makes the team, the leader, and the followers to communicate better. It starts the discussion, the conversation, and it helps people do not forget. So as part of the crisis resource management that we have taken from the aviation industry is that we need to increase our training in all these non-technical skills that are going to help us resuscitate and manage crisis or emergencies. So cognitive aids, and as the other expert is going to talk, we need to communicate better, and cognitive aids are going to help you do that. Part of the way they work is because when you are under stress, your memory is going to decrease. So you may forget steps, forget doses, or mix information. So use them because I am sure you're going to forget something. And the other thing is when we make decisions, there are several things that we do. When there's a situation, we rapidly go through the different assessment of what is happening. We go through a path in order to confirm or refuse the hypothesis that this is happening to the patient and start actions on how to treat it so we can resuscitate the patient. And when we are taking action, we need the recipe. We need to start placing some steps, and in order for you to not forget them, cognitive aids are going to be there. Just for review the evidence, there are systematic reviews showing that there are stressors like noise, fatigue, illness, severity of the patient, and cognitive aids is one of the factors that is going to mitigate the way you perform under those stressful situations. And also when there are different moments where we can decrease the human factors to decrease outcome for patients, and cognitive aids is there to help you memorize the things that you need to the need things and steps that need to be done in order to help. And there are more narrative literature where they found that this is going to help teams communicate and do not forget steps. So there is more studies, and when they come together with all the checklists, the ones that are used for routine and the ones that are used for crisis, if you put the outcomes together, 50% of them are going to decrease in mortality, perioperative mortality, if they use properly. And all the literature around crisis has been done in simulation lab. What it does show is it decreases human error, improves patient safety, teamwork increases, and the quality of care. There are some cases in which you do not use cognitive aids, and these cannot be used in order just to train our students. And if this is distracting the leader of the team, do not use them. Use your judgment. If the cognitive aid is not properly implemented, this is actually going to distract you. So be very aware that this is not just cognitive aids, it's not perfect. It has to be properly used. And part of that is you need to train and use them, the one that you are implemented in your hospital. So what are the resources? In 2018, the SNAC presented the guides for emergencies, and I highly recommend them. And also, we have courses and books with the algorithms, with the ENLS, and please look for them. Go to the courses because it helps you create a standard way to put in place the standard measures and then the treatment for the specific crisis and the neuro emergencies. There are also teams coming together, putting the protocols and the code, for example, a code stroke and the checklist, so people do not forget some of the steps and things that had to be done at the perfect moment. And also some literatures showing if you have cognitive aids to communicate, then this is going to impact outcomes. I'm not going to talk this because there's another lecture coming with this, but this is going to help things. This is going to impact outcomes. So please use them, but they do not help if we do not implement this. If we don't work, we work in an environment, we work in a hospital, we work as a team. So we need to come together and implement. So we create, we train, and we create a culture about it. And as you can see in this article, they showed in their own hospital and the resuscitative room the way they were going to display everybody, what they were going to do, and as you see with the arrow, where the cognitive aid is going to be, so it can help the leader the moment he wants to look for information. Some of the barriers, it's very sad to say, but some of the barriers, some people think there is no time to go to a cognitive aid. And I always say to my students, the pilot is going to die with the plane and is going to crash. And they have seconds to go to the cognitive aids looking for the answer, for something that they are forgetting. So we do have time, but we need to train to use them because they do not help by themselves. Like that manual is not working if people around it do not train and know how to use it, where to look for it, and how the information is displayed. So in conclusion, they're available, they can help you, and they can optimize the way you treat patients, but we need to practice, we need to make this part of our culture. So thank you so much for inviting me. I hope this is going to help all our patients. There are some resources there, a podcast, a video, and also the web with the implementation emergency checklist. I highly recommend you to look for it. And here is my contact information if you need me. Thank you so much.